Hello, thank you for joining us. My name is Lisa Hayward and I am at the Department of Education in the Office of Social and Emotional Wellness. And I'm really happy that I'm being joined today by my dear friends and colleagues, Molly White and Catherine Lesswing. So today, in the next few minutes, we're going to be talking about how we can focus on developing a Tier 1 system and practices. So let's jump right in. What is a Tier 1 system and practice? Well, this is the focus of what we're going to be doing. We are, in the weeks ahead, also going to be looking at a number of other issues. If you want to look at items 2 through 8, so mark your schedules and keep an eye open for what we're going to be streaming in the weeks coming up. But today, we're going to be talking about what a Tier 1 system actually is. So the first question you might be having is, why should I be listening to you for the next, 10 minutes? Why should schools build a Tier 1 system and have practices associated with it? Well, you probably already know this, but 14 to 20% of youth between the ages of 8 through 15 actually experience a mental, emotional, or behavioral disorder. And only half of those students receive treatment for it. So without the support of a Tier 1 system and practices, students are most considerably in greater risk of such things as chronic absenteeism, reduced academic achievement, suspension and expulsion, school dropout, substance use, risky sexual behavior, violence, and in the most extreme and tragic cases, suicide.
Thank you, Lisa. And you really set us up beautifully to talk about now what are Tier 1 systems and how do they help to prevent some of those larger risk factors. In practice, and in theory, a Tier 1 system is a collection of prevention strategies. And so how do we build out a system in schools to help students build up their protective factors? When we do build up Tier 1 systems and practices, we can help students reduce problem behavior and discipline events that might take them away from the learning environment. We can improve their social and emotional functioning and wellness, help them come to school and ready to learn in a positive school climate. Most importantly, or very importantly, as Lisa pointed out, having prevention strategies and a system in place allows for accurate identification of students who do have those greater needs. So those 14 to 20% of students who really do have a clinical mental health need. And without prevention practices in place, it becomes difficult to understand exactly who has something that might warrant greater intervention and who is just responding to a school climate or a classroom climate that doesn't have structures in place to help all students learn. So what are actual practices that schools can employ? And as Lisa mentioned earlier, over the course of the next several weeks, we're going to dig deeper into some of these particular practices to really help you and your school think through how you might put some of these in place for the fall. Again, universal Tier 1 practices are for all students. So that means every student in the school building has access to these supports, whether they have an IEP, a 504, whether they're in AP Physics, all students in the building are getting these supports. And they can include having school-wide positive behavior expectations, restorative disciplinary practices, a way to track data so that you can screen for students who may need extra intervention who are not responding to the prevention strategies in place. A single request for assistance for identifying students with greater need, a universal social emotional curriculum, and more. And so like we said, we'll dig into those more in this series. with any practice in a school building, if you implement the practice or the strategy, it is much more sustainable if it's part of a greater system. So it's part of a whole operation that is looking at how do we sustain this particular practice over time, make sure that staff are trained up properly, have the proper supports. We're looking at data. And so these are some of the pieces of a tier 1 system that help those practices, those select interventions that your school chooses to continue and to sustain over time. They include looking at what interventions and practices are already happening in your school. Are there things you'd like to change? Are there things that you are duplicating? Are there things you would like to add? Reviewing data regularly, making sure school staff are trained on the particular practices that you've chosen, looking at data as a whole school regularly, and continuing to monitor and evaluate the outcomes for students. So with that, I'm going to pass it to my colleague, Molly White.
Thank you so much, Catherine. So everything Lisa and Catherine went through was kind of the why and how of building up your tier 1 system and the practices within that. And what I'm here to talk about is how that tier 1 system fits within the multi-tiered system of supports for behavioral health and wellness, or the MTSSB framework that my colleague Catherine and I consult on. So when you're thinking about tier 1, obviously it falls in that bottom tier there, but each of those things that you're doing independently of an MTSSB framework can fit right within there. So whether or not you're actively engaged in the MTSSB work, knowing that what you're currently picking up, whether it be implementing a tier 1 universal SEL curriculum or looking at the systems and structures for referring students, each of those pieces can support your upcoming, or if you're thinking about MTSSB, it can support that work. So we just like to draw attention to the fact that each of these things can be done independently if a school or a district hasn't officially or formally adopted the MTSSB framework. But if you're thinking about doing it in the future, just drawing your attention to the fact that it is in support of this work. And if you have any questions about what we covered today, or any questions about how it would align with MTSSB, or if you want to begin thinking about implementing MTSSB, we encourage you guys to reach out to a consultant. I serve Southwest New Hampshire, Catherine is in South Central, and we will be hoping to fill Lakes, North Country, and Southeast in the near future. If you find yourself outside of South Central or Southwest, please still reach out. We're happy to consult or talk about future work together. And as my colleague Lisa alluded to earlier, please stay tuned. The next video we will be releasing is around school-wide behavior expectations, and we will go through this whole list this summer to support you in reopening your school year this fall. Thank you so much for tuning in today. I hope you have a great day and stay well, and we look forward to hearing any comments or questions you may have. Have a great day.